Today, we're talking about what you need to know about congestive heart failure. The following portion of Live at 9 is sponsored by Stern Cardiovascular Center. And to learn more, we are joined by Dr. Ari Shekhovsky. Thank you so much for being with us.
Thank you for having me.
Okay, so if I were told that I have heart failure, how is that determined?
The way that we determine whether or not somebody has heart failure is a combination of symptoms, shortness of breath, inability to lay flat on your back because you get short of breath, waking up at night gasping for air, excessive swelling, or otherwise known as edema, fatigue, coupled with some testing. And the testing might include an echocardiogram and an ultrasound of the heart. And the ultrasound of the heart will identify whether or not you have a weakness of your heart, called a cardiomyopathy, inability for the heart to pump blood to the body, or whether there's a problem with relaxation of the heart. The heart has to do two things. It's got to pump the blood to the body, and it's got to relax to let the blood get into the heart so that it could pump it out.
And what causes heart failure?
What causes heart failure? There's a number of things, and that's part of what's necessary to figure out once you've been told that you have heart failure. The most common cause is coronary artery disease, blocked arteries. Other possible causes are uncontrolled high blood pressure, genetics. There are certain drugs, exposure to certain chemotherapies. There are certain what we call systemic illnesses. These are diseases that affect the entire body, like lupus, or other autoimmune diseases.
Would you say all heart failure is the same? Is all heart failure the same?
No, not all heart failure is the same. There's heart failure is dependent on how severe your heart failure is, how symptomatic you are, whether or not it could be reversed. So when you see a doctor for your heart failure condition, that doctor needs to determine why. That doctor needs to put you on medications that have been proven to help improve the function of your heart, live longer, and eliminate symptoms. At the same time, it's important for you to understand how you can help yourself and to listen to the advice that you're given. A lot of the reasons why you may have developed heart failure is because of some of the lifestyle choices you've made. Those have to change. The other important factor of living with heart failure, and you can live with heart failure, is when the medications no longer work or you're not responding, that your doctor or cardiologist has access to people with advanced heart failure capabilities. There are a lot of things that we can do when people don't respond to typical medications. There is a advanced heart failure program here in Memphis through the Stern Group. It's the only one where if the medications don't work, there are all sorts of different devices, therapies that we can provide, and we can even take you through transplant if that's necessary.
Thank you so much, Dr. Shekhovsky, for helping us to understand this, and we were able to put your information up on the screen, thankfully. And the preceding portion of Live at 9 is sponsored by Stern Cardiovascular Center.
Thank you.